All right, everyone, welcome back for another deep dive with us. Today, we're going to be looking into something pretty major. It's a big story that's been developing, and we're going to be taking a look at this NHS screening error that's been in the news.
Yeah, it's a significant one.
Yeah, so basically, we're talking about thousands of people who missed routine screenings for some serious illnesses, and this all comes down to a technical error, it seems.
Right.
And we're going to be looking at this source that we have here. NHS screening error impact on thousands. So we're going to really sort of unpack this and see what we can learn from it,
Yeah, and why it matters for everyone, really. I mean, this is a situation that I think has a lot of implications for all of us. When we think about the healthcare system and how we rely on it.
Absolutely. And, just thinking about the potential consequences here for the individuals involved, it's pretty huge. So let's just jump right in. Can you maybe give us a little bit more context? Like, how many people are we talking about here who missed these screenings?
Yeah, sure. So the numbers we're looking at are pretty significant, up to 5,000 individuals in England alone, and that's a conservative estimate.
Wow, 5,000. That's a lot of people.
It is. And what's even more concerning is that this error, it wasn't something recent. It actually dates back to 2008.
2008. So we're talking about like almost 2 decades of missed screenings. That's a really long time.
Yeah, it's quite a long time. And when you think about the types of screenings we're talking about, these are for potentially life-threatening illnesses like cancer, bowel cancer, cervical cancer, aortic aneurysms. These are not things you want to be missing screenings for.
Absolutely. And so what are the potential consequences then for these individuals who miss these screenings? I mean, we're talking about early detection being so crucial for so many of these illnesses.
Right. And that's exactly the point. If you're not catching these things early, then the chances of successful treatment go down. The later you catch something, the harder it is to treat. So, imagine someone who should have had a mammogram years ago, but didn't because of this error, and now they're finding out that they have breast cancer, and it's progressed further than it should have. That's a very real and very scary consequence.
Yeah, that's a huge impact, and it's not just the physical health implications, right? There's also the emotional and psychological impact of something like this.
Absolutely. The anxiety, the stress, the uncertainty of not knowing what could have been if you'd had that screening on time, it's a huge burden to carry.
And what about we've talked about the individual impact, but what about the broader impact on the healthcare system itself?
Well, you can imagine that this is going to put a strain on the system right now. They're trying to contact everyone who missed screenings and get them back in for testing and treatment. But that takes time and resources, and there's a potential for a backlog, a surge in demand, which could further strain resources.
And we talk about the NHS already being kind of stretched thin in a lot of ways. So this is not going to help.
Right, exactly. This is going to add to an already existing problem.
So, we've been talking about the consequences, but like, what exactly went wrong here? I mean, how does something like this happen? A technical error that slips through the cracks for so many years?
Yeah, it's a good question, and the source doesn't go into the very specific technical details of what caused the error, but it does highlight that there was a lack of robust monitoring and error detection systems in place.
So it's like nobody noticed, basically, for all this time.
Well, it seems that way, yeah, and it makes you wonder, could this have been prevented if there were better oversight, maybe a human element involved in the process? Sometimes we rely too heavily on technology and we forget that human intervention is still crucial.
Right, that checks and balances system.
Exactly. And it's a reminder that even the most advanced systems can fail. And when it comes to something as important as healthcare, those failures can have serious consequences.
Yeah. So I guess the question now is what happens next?
Yeah.
I mean, what's being done to address this situation?
Well, from what we're seeing, the NHS is taking this very seriously. They've launched a huge effort to contact everyone who missed their screenings, and they're trying to fast track them through the system to get them the care they need. But as we discussed, that's not a simple fix. There's the backlog to deal with the potential for increased demand, and then there's the psychological impact on the individuals who are now having to catch up with their health.
Right. It's not just a matter of, okay, you missed this appointment, now here's a new one.
Yeah.
It's much more complex than that.
Exactly, and brings up a lot of questions about how we can prevent something like this from happening again. How can we ensure that screenings are reliable and timely for everyone, and how do we strike the right balance between technological advancements and human oversight?
It's a big challenge, and it's a reminder that healthcare systems are complex, and there's always room for improvement.
Absolutely.
So as we kind of wrap up here, I'm left thinking about this idea of early detection being so key for so many illnesses, and what are the costs of delayed diagnoses, not just for the individuals, but for society as a whole? It's a question that we really need to grapple with.
Yeah, it's a big question, and this situation really highlights the need for vigilance and continuous improvement within our healthcare systems. We can't afford to be complacent when it comes to something as important as people's health.
Absolutely well said.
Yeah.
Well, thank you so much for breaking this down for us today. It's been a really insightful conversation.
Glad to be here.
And for all of you listening out there, thanks for joining us on this deep dive, and we'll catch you next time.